Hello, this is Bryson Leppa. I'm the Vice President of Clinical Services for Rebound. Today we have the great pleasure of talking to one of our amazing providers that's part of our network, Dr. Roddy McGee out of Las Vegas, Nevada. He's part of Total Sports Medicine and Orthopedics, and we're very lucky to have him treating our men and women in the Arizona and Nevada area. And we'll turn this over to Dr. McGee.
You know, a lot of your focus is on the first responders, and we like to think of them as our occupational athletes. And so we really wanted to have, and deliver sort of the professional sports model of care to that area. One, because they deserve it. Two, because in their case, return to work, we treat similarly as return to play in sports. We know guys need an answer quickly to what the injury is. They need a plan in place for how to get back to being able to be active and perform their duties. And we wanted to be a part of expediting that process, allowing them to have access in an expedited manner to expert care.
Are there common injuries you're seeing with these folks?
Well, you see the common things that we see in sports, and that's why it fits well with the injuries that we normally treat. So you see shoulder instability, you see lower extremity injuries, whether it's knee or ankle or Achilles. And it's really similar to the sports environment. In sports medicine, the most common two spots are knee and shoulder. So that ends up being a lot of the things that you see when these guys are working.
And how does it help you to see them faster as opposed to them getting kicked around from an urgent care or primary care doctor to you? Does it help you to see someone a day or two after injury?
It certainly helps with certain injuries to be able to treat them as quickly as possible. When we think about our fractures or certain tendon or ligament tears, in some cases, if it was a few weeks, it wouldn't dramatically change the outcome. However, and it wouldn't change anything from my side to see them quickly necessarily in every case. But I just know, and I see the frustration in the folks that spend weeks going through a process that isn't really getting them further along until they finally are seen and somebody can say definitively, this is your injury and this is the game plan. Let's do it and get you on the track to recovery as quickly as possible. So from my standpoint, the main thing is just feeling their frustration, knowing and understanding the scenario of maybe their supervisor is, creating some stress for them to say, hey, like what's going on? And let's either, I need to know if I have you available. It's the same thing as the coach, right? Do I have my star player available? Can I utilize them the way that I want to be able to, and I'm used to being able to, or do I have to make modifications so that they can make their game plans? So, everybody's got jobs to accomplish and people to answer to, and they just want to know what is the plan.
And I was going to actually speak to that real quickly is, when with your sports medicine background, the teams you treat, what's the normal process when you're seeing an athlete from injury to care?
If it's one of the athletes that, for a team that we are specifically affiliated with and work with, they call me directly. They're seen that day or the next day. They're in an MRI scanner that day or the next day. And, they could literally have within 2 to 3 days, injury evaluation, MRI, and on the surgery schedule.
And that's what we're trying to bring this whole program to the first responders as well. You've been with us for a while, understanding what we do this. If we were approaching a new provider, why would you tell them they should be involved with this population for the most part?
Well, it's a great group to take care of because, again, back to the athlete scenario, these guys are motivated. They enjoy what they do. They like working hard, and the injury is an interruption to what they want to be doing. So it's a highly motivated group that will listen, pay attention. They want to get better. And when you've got that already in your favor, they're gonna have a good outcome because they want to make it happen.
And has that been your experience for the most part? I know it's been a small sample size, but from rebound patients, have they fallen into that category for the most part for you?
Definitely. Every guy has not only been motivated, but so appreciative of, having that kind of access and sort of being treated in this concierge VIP manner. They really like it. And they're happy to, in some cases it's, reassurance that, hey, this doesn't look bad. Let's, do a few simple things and you should be able to get back quickly. or if it's something that requires surgery, it's knowing that, okay, we're not going to screw around with this for 3 or 4 weeks before we have you taken care of, and then you're starting your rehab program. It's, this is urgent. We want to get it done now, and we want you having surgery and in therapy the next day to cut down that time before they're back to what they want to do.
And the Arizona guys have had zero problem having to come to Vegas for a day or two to see you. So that's always been a nice addition of having you up there.
Yeah, I can't speak to what they do outside of their time, being evaluated, but it hasn't been too far away. And like I said, even though they've had to travel a little bit, being able to have that access almost immediately, it's been a fair trade in their, from their standpoint.
Well, I was going to say, and quickly, Doc, it's probably the last question. You had texted me before that you had seen someone from Las Vegas police or fire, and that you said their process was a lot more difficult. Can you speak quickly to what the challenges were you faced in those specific cases, what you've seen up in your area?
Well, I think if, anybody that has a process where they're required to see a physician who doesn't normally evaluate and treat these types of injuries and know and understand, again, the return process, return to work or return to play. There's times when they get hung up in what seems like a scripted process where, let's just take a simple example. And one of the more common things, you look at like a meniscus tear. If a patient presents with a meniscus tear to or a physician that's doesn't routinely treat these, they may attempt a conservative plan for a period of time. But if the patient's now taken a few days to be seen, and then he goes through and is told to go to physical therapy, then has to return, says he's not getting better, then has to get scheduled for an MRI. If that process takes any amount of time, sometimes these guys are saying it took 2 weeks to be scheduled for an MRI, then another couple of weeks for their follow-up visit. Now they're being referred to orthopedic surgery, and then additional time to being scheduled for their case. I've had in some cases where an officer has had more than the return time waiting just to be treated. So they're showing up to see me at 6 weeks after their injury occurred, when we should be planning for them to be back at 100% without restrictions, and they're just still at the beginning. So, they express that frustration to me, and I can feel it. And it's frustrating knowing, like, this is the first time I've seen you. And if you had just known that you could come here the day that you were hurt, we would be so much further along the steps that, and, I don't have exact numbers in front of me, but I have to believe that, that repeated over many, many times, and the number of injuries that firefighters and police face, the cost savings would be tremendous.
Absolutely. Thank you, Doc. Appreciate it so much. Great seeing you again.
All right. Talk to you later.